The NHS can do so much. It's great at treating illness, it's fantastic at providing life-saving treatment, but actually there's a role for all of us to ensure that we stay healthy.
Staying healthy is all about physically staying healthy, but also psychologically staying healthy as well.
It's important to take your own health in your own hands. I mean, I've got osteoarthritis, I've had a replacement hip, but there are certain things I still have to do to keep me healthy, rather than just being my illness. It's owning your illness, it's not allowing the illness to own you.
We only have a limited resource, and actually if people can help themselves to be as healthy as they possibly can be, even if they're living with a long-term condition, they can reduce that demand on the healthcare resources, and then ultimately we have more money to provide the services that people need.
We had a real great opportunity about working with our colleagues at Newark and Sherwood District Council to enhance the facilities at the new leisure centre in Newark.
We started a consultation process with a lot of stakeholders, including national governing bodies, our existing customer base, disability groups and sort of key groups to try and influence how the development will take place.
What we're constructing here is a 4,500 square metre new purpose-built leisure facility.
It consists of a 6-lane 25-metre main pool, a 20-metre learner pool, a changing village,
4-court sports hall, squash courts, a 200-station fitness suite and 2 dance studios.
I think our opportunities are great really with the NHS. We've already been running quite an established GP referral scheme. For persons with disabilities, they'll have far improved access, better access for the carers as well. What we're trying to do is build a family centre where it's not about the elite athlete, it's just about the local community using it. I think it will just be a fantastic offer really, which will achieve a lot more for the local community as the time passes really.
As an NHS, we're often really good at designing the technical bits of pathway changes and different services. But actually by engaging with our local population, we also get their insight about how services should be organised and delivered. And that, I think, bringing that together with the technical expertise that doctors and nurses have, means that we actually get a better service in the end, because we get the customer sort of insight alongside clinicians.
Our communities are all very different, so we would engage with lots of different communities, hard to reach groups, to gain an insight for the CCG to base their plans on.
I think patients like to engage with the CVS because they feel they're talking to real people. We're not medically qualified and we can talk to them on their terms in plain English, and we translate things so they understand how the healthcare system works.
We put them in places where carers go. It's run by carers, for carers, and we find hidden carers. No matter what disease the person they're caring for is suffering from, it's all carers right across both city and county, wide open to everyone. It's very important that carers look after themselves. This is a chance for the carer to get something that they want and they really need so they can survive as long as I have, basically. My son's got a learning disability and autism, and he's 43. So I've been a carer for 43 years and counting, basically. But I've got to say his name now. His name's Scott, and he'll be thrilled to bits when he sees it.
The NHS nationally and locally is fantastic. Things go wrong, of course, but the service we provide, I think, is really high quality. I think what does frustrate me is when people sit on the sidelines and criticise, and yet don't take the opportunity to be positive when they can, and don't take the opportunity to help shape where things are going. One of the things I've always loved about the CCG since its inception, I think it really is a CCG that listens. You know, whether you're a GP, a nurse, a manager like me, a patient, there are lots of opportunities to get involved and to share what you think.
My message to everybody would be, you're not going to change it if you don't get involved, because you can only change something from within, not from without. So getting involved is important, even in a small way.
It's your local NHS. Come and help shape it with us and make sure that it's an NHS that you and your family and the generations that go beyond you are really proud to have services delivered from.